lungs, we'll need to know how to use our stethoscope properly. The first thing to do is figure out how to put it in your ears. Now, it may seem very intuitive, but just to make sure we're on the same page, you want the earbuds facing forwards or rostrally so that they fit into your ear canal. So make sure that they're positioned correctly. And then the second thing to pay attention to is the diaphragm and the bell. So some of you folks will have a stethoscope like mine that will transition from the diaphragm, the larger side, to the bell, the smaller side. And there's usually a little notch located to say that this notch is here, so now I'm going to be hearing the diaphragm side. If I wanted to move to the bell side, I would simply switch it over, and now that notch would be on the right side. If you're not sure, you can always put your stethoscope in and give a very gentle tap, and you should hear that if you're on the right side. So if you're in the OSCE and you can't hear anything, make sure that you're on the right side. So what does that actually mean? So the diaphragm is meant to pick up our high frequency sounds. These are going to be our normal heart sounds, our normal lung sounds. If I had a heart murmur that I wanted to evaluate further, I would switch it over to my bell side, and that's going to pick up my lower frequency sounds, such as my heart murmurs or other abnormal lung or heart sounds. If you are someone that just has a one-sided stethoscope, you're going to push harder to engage your high frequency to listen to our normal lung and heart sounds, and you're going to pull back on your pressure, and that'll pick up on your lower frequency, our more abnormal lung sounds. All right, so when I'm doing a cardiac and pulmonary auscultation, I want my patient to be standing. Sitting is okay, but standing is going to give you the best sound. So when I start with my heart, I'm going to be listening to 3 different positions here. We briefly talked about where that loudest beat is going to be heard and felt, and again, that's going to be at the 5th intercostal space, and that we can count backwards to find, and that's going to be his mitral valve. And then if I transition to the 4th intercostal space and go up a little higher, that's going to be the aortic valve that I'm going to hear. And then if I continue cranially to the 3rd intercostal space, and a little bit more ventrally, that's going to be the pulmonic valve. I don't expect you guys to hear and appreciate the differences amongst those 3 different valves, but it's important to start thinking about where your stethoscope is located on your patient as you're listening. So if you do hear a murmur, over time you'll be able to locate exactly which valve that murmur is coming from. So I'm going to place my stethoscope appropriately in my ears, facing forward. I'm going to make sure that I'm on my diaphragm because I'm expecting to just hear normal heart sounds. I'm going to let my patient know that I'm coming here. I usually put a little gentle rub there. I'm going to start with my mitral valve. That's usually where I begin. I'm going to listen to at least a few beats. The heartbeat should be strong. It shouldn't be a soft or muffled sound, and it should have a nice normal rhythm. And then I'm going to move cranially and dorsally to my aortic, and then I'm going to move ventrally and cranially to my pulmonic valve. And the other thing I want to appreciate is his femoral pulse. So the pulse should be synchronous with the beat. So I need to have my stethoscope in place so I can hear the beat. And I'm going to find that femoral pulse with my hand, and it should be a beat pulse. It should be very synchronous. I'm going to make sure that both pulses in these femoral arteries are synchronous, so I switch to the other leg, and again, beat pulse. And that femoral artery should have a nice strong beat to it. It shouldn't be kind of thready or weak. And so that's all I'm going to check on his left hemithorax. So I'm going to actually have my great assistant Natalie flip him around here. We'll check his right side. All right, buddy. Okay, and so for the right side, the only valve that you're going to be hearing is his tricuspid, and that's going to be located around the fourth or fifth intercostal space. It's basically on the opposite side of that mitral valve. So again, we could count back 13 ribs all the way up to this fourth or fifth intercostal space and find his heartbeat there. One thing to note for our canine and cats, our cat patients, is that you often can't differentiate the lub-dub. We think about our heart sound as lub-dub, lub-dub. That's what we as humans sound like, but in dogs and cats, they've got such a high heart rate, we can't separate that S1, the lub, from the S2 dub sound. So it just sounds like lub-dub, lub-dub. And so when you're counting and getting a heart rate, be thinking about that. This is important when you move to equines or other larger animals where their heart is so big and they have such a slow heart rate that you're going to hear a lub, dub, lub, dub. So S1, S2, S1, S2. And that sound is the valves closing and pushing blood out of the heart. You hang in there, buddy. And so it's important that when you're counting an equine that you're not counting the lub and the dub as separate counts or beats of the heart. Otherwise, you're going to actually have a double the heart rate. So just be mindful of that when you're transitioning between species.